This video is to introduce the part 2 of the patient education paper. Choose the right instructional material. Let's review what you have done in part 1 of this paper. In part 1, you have described a characteristic of your patient or the patient population as your learner. And you identify your learner's needs, including their learning needs and health needs. Based on these needs, you describe a teaching intervention. The teaching intervention includes the learning content and the teaching methods. In part 2, we will address the learning content and how the learning content will meet your patient's learning needs and health needs. In part 3, we will discuss more about the teaching methods and how these address your patient's learning needs. Let's go back to part 2. Choose the right instructional material. In order to meet your patient's learning needs and the healthcare needs, you will find the right instructional material that include the right learning content. And the design of this instructional material must meet patients' learning needs as well. For example, if your patient's learning style is visual, your learning material might be more pictures. Or if you choose a YouTube video, it must be something like cartoon or easy to be understood or very engaging, or the video must be very short. If your patient has a low health literacy, the learning material must follow the very plain language. And if your patient's prior knowledge about what they need to understand is very low, the learning material must address their prior knowledge based on what they already know and what they are interested in, and start from there to engage them and help them to understand. And the culture, if you want to choose the language, the learning material must include the right language. Of course, these are just some of my examples. I suggest you to be very creative, because these characteristics are what you have made up. So make it fun for you. And try not to repeat what I have just said, because I don't want you to be a machine, just repeat without learning. So I hope you to really process these knowledge and apply what you have learned to your daily life and to a real setting and to something you're really interested in. You can either select available material, such as the website. You know, there's a lot of websites available now, or an app, which happen a lot nowadays among patients, or YouTube videos. Again, there's a lot of YouTube videos out there, or the brochures, or the book, or you can find some pictures from the literature, or if you work in a hospital, the hospital has some brochures. You can choose those brochures too. If you do not find any learning material that fit the patients you are describing, you can make your own instructional material. Because the purpose of this practice is for you to understand how the learning material will fit the learner's learning needs and health needs. Sometimes it happens that we choose to educate patients using the material only based on what is available or what is out there. We really do not think from patients' perspective what they really need. In this paper, after you have selected the right learning material, you will need to provide the source, either the name or the link of the website. And if it's available, you will need to cite it using APA. For example, if it's a YouTube link, you will use the right citation. You can find how to sign a YouTube link from the APA website or from your APA textbook. If it is a printed version, the material is printed and there's no resource, no link for you to cite, you can take a photo as a sample and use it as an attachment at the end of the paper. Of course, the title of this attachment must be in APA too. And if you choose to make your own, for example, if it's a picture, you can upload it to the paper and as an attachment here, same as the photo here. And if you make a website, you can provide the link of the website. These are just the example. The purpose is for me to understand and take a look at the same material that you are going to use. The second step is to assess your selected instructional material. Sometimes the reason for this step is that sometimes we just use what is out there. We don't know the quality of this learning material. This step is to help you to evaluate the quality of the learning material. There is an assessment tool from your textbook. And sometimes the score might not be that high. Which is fine. This process is to help you to understand this assessment step is necessary in your teaching. And then you need to discuss why you have selected or made this learning material. Like I said, this learning material is from Part 1's learning content as part of the teaching intervention, and the purpose is to meet your patient's learning needs and health promotion needs. Let's come back here. You also need to discuss how this learning material relate to your learner's learning needs and health needs. For example, the learning needs include their learning style. For example, if they are more visual, this material include lots of pictures for them. If they are low health literacy, the material is full of plain language and it's very short. And for the health promotion needs, the material include the right content they need to learn based on what you have described about this patient. And in step 4, you need to make revisions of the Part 1 paper, because at that time, when you start working on Part 2, you should get feedback about your Part 1 paper from me. In step 5, you need to step the revised Part 1 paper and the current Part 2 paper as one paper. And you always need to read the rubric and follow the highest standard when writing this paper. All right, this is the end of this introduction.